It is the year 2020. Carlos is 85 years old. He has diabetes and heart disease, but he still manages to live remarkably well on his own, just with the help of technology. When he was younger, there was little interest in prevention in his community. Carlos smoked, ate a poor diet, and exercised little in early adulthood. But for the past 15 years, Carlos has placed much more emphasis on prevention in keeping with the development of a health-promoting environment. El Dorado, the community where Carlos lives, has changed dramatically. It has become a healthier place to live. Many shops sold fast food, but now it is easier to buy fresh fruit and vegetables. Also, the shops in his neighbourhood used to sell cigarettes, and the bars were full of smoke. Nowadays, all public places are smoke-free. Exercising was difficult in the past because the streets were jammed with traffic. Now, traffic congestion has declined and cycling has increased. In fact, Carlos himself cycled up until 5 years ago. On a national level, the government has also worked hard to develop policies that can reduce social, labour and health unevenness in this region. This unevenness was one of the main reasons why people in the country were experiencing multiple chronic diseases like poor housing conditions, poor air quality, food and water. From the age of 60 onwards, Carlos was regularly screened for risk of heart disease and strokes, abdominal aortic aneurysm, bowel cancer, diabetic eye disease and high blood pressure. Carlos was at high risk of heart disease and stroke at the age of 50. In addition to improving his health behaviour, he began to take a poly pill. The local community health service has started to concentrate on people with multiple health issues. From the age of 60, Carlos was contacted regularly by a community health worker. From the age of 70 onwards, he was regularly visited by a nurse who came more often if he was having problems. Since then, advances in technology have enabled him to be kept informed of his health status, and a nurse contacts him if necessary. He also has a health worker who comes to offer emotional and social support. The combination of all this has allowed him to stay at home. Creating the conditions that has helped Carlos stay healthy has depended mostly on building a sense of health in his community and on the efforts of local planners, authorities and health service managers. Thanks to the skills of these professionals and good coordination, we can receive optimal health outcomes.